Thank you. That is great. And I am really honored to be here today. I think it's been a phenomenal group, and there's been a lot of thoughtful discussion. Before I switch over to my photo, which is in honor of Dr. Donovan, I'll explain a little bit about what that photo represents to me. But I wanted to say, in the role that I normally serve, which is for the Governor's Office of Planning and Research, we've done a lot of work with active design for Sacramento, and it's fantastic. So I'm here today to stand in for Dan Geiger, who's the Executive Director at the U.S. Green Building Council. It's a volunteer role that I've played over the last year, which has been really exciting. And I think just before I go into that, this is actually a picture from when I was a kid. I grew up in New Mexico, and some of the first memories I have are being around the built environment in green space. I think that, one of the questions that came up is, what about in underserved populations? Would that be something that they wouldn't want? Having spent a lot of time as a pediatrician working with populations from different backgrounds, it's really powerful, but I used to do community-based participatory research. And that allowed me to do a lot of work with patients. And we did a project where the families actually went around their environment and took photos of what mattered to them. And one of my patients' moms was participating in this study, and I saw this photo, and it was a photo of green space. And it just really spoke to me, because it was her saying, this is what matters in my environment, this is what matters to me, for my children to feel happy, to feel safe. So that's kind of the story. So in my time with U.S. Green Building Council, it's been really exciting, because we've been doing a lot of work around cross-sectoral partnership. It was actually Dr. Howard Frumpkin who initially encouraged me to get involved with the U.S. Green Building Council. And he knew that I really cared. After spending so much time with patients, I spent a lot of time when I was in clinical practice actually writing letters on behalf of patients with asthma, because they would be sick. We would prescribe steroids, we would give them inhalers, we would do all of these things, and yet they were coming back sick because they were exposed to so many environmental hazards, particularly in their home environment, but also in their school environment. And so when Dan Geiger called me up and he said, we're part of the U.S. Green Building Council, and we're interested in building a health initiative, and we're a lot of architects and planners and engineers, what do you think? And I had very little time to say no, because it was such an exciting opportunity to me. So when we got together, I think going back to what Adrian said, there's a lot of discussion. When you're working cross-sectorally, it can be really challenging, because you are speaking a different language. So the U.S. Green Building Council before had done an initiative on energy use. And so it was very easy to get around energy use. It's much easier to measure water or waste or emissions, but it's much harder to measure something like health in a way that's looking at a lot of different professions. So we started just having these groups over the period of a year, and we said, well, how are we going to do a challenge for health? Like, what are we going to measure, and what would be our outcomes? And after the period of about 4 to 6 months, I think it was, getting together to discuss what we wanted to do, we came up with really 4 key priority areas. We really wanted to frame the discussion. So why does health matter in this? I think the U.S. Green Building Council does a lot around sustainability and a lot around procurement, but where's health in this, and how does health play a role? We also wanted to elevate the importance, so I think that's been something that's been talked about a lot today. So really starting to have this conversation so that it's not just something that's in conferences, which is really important, but that it gets out there, that it becomes part of the general discussion. We really wanted to integrate across practices. So it wasn't just about one sector saying this matters, but I think that the Active Design for Sacramento team is a fantastic example of that it's something that crosses all sectors. And then to really educate. That was going to be a big part of what we were doing. So when we got together, we thought about different strategies. Again, providing information, education, accelerating demand, and expanding the conversation. When we looked at the different stakeholders involved, we wanted to narrow it down, but still keep it broad enough that there was this room for discussion. And the U.S. Green Building Council really has a huge membership, which is really fantastic. But it's a really unique opportunity because in addition to health sector and public sector, there's a lot of work that happens in the private sector, which was what was also really important to me. So for instance, when we were thinking about buildings, building owners and tenants, we were thinking about some of the opportunity to educate around some of the materials that are purchased. So health product declarations, which a lot of people in medicine wouldn't necessarily know about. When we were thinking about product manufacturers, actually having them develop health product declarations so they could say how that matters. And I think just even the discussion around the research that's been done for exposure to green places, that's the kind of conversation that can start to happen when everyone comes together, even for where windows are placed or what kinds of things you're looking at when you're designing the building. For the health sector, it's been fantastic because I think one of the things is that as a physician, especially when I was practicing with patients, we were thinking about asthma and again, going back to the inhalers, but when you start to think about what are some things you could do to solve the problem so that people were living in healthy homes or working in healthy places, and this is a great opportunity where we've been able to bring the health sector in, so we've partnered with UCSF, for instance, to help host a symposium. And the contractors. So again, really thinking about how all of these different partners can really tell a really important story. So we launched the Building Health Initiative back in November. Apparently we had a lot of press coverage because you guys heard about the initiative through the press, I understand. And it was really fantastic just to get a sense of the organizations that are working with us, that are our sponsors. So CalPERS is signed on, Google, for instance, Adobe. And it's really just amazing. I was just at a talk the other day with CalPERS, and they do a lot, not only of the insurance for employees for the state of California, but also a lot of investing because they control the pensions. And so it's really powerful to hear that a partner that we're working with is actually looking at long-term investments. And that's something that came up earlier in the conversation today. But instead of thinking about, well, this is in the short term going to be harder, thinking about over the long run, how can we invest in buildings and in communities that's going to have a return, thinking more around 100 years. Some of the examples of this collective partnership that have emerged is that Adobe, for instance, is doing a partnership with Berkeley to look at the power of their green buildings and how that affects health. We've been partnering with Berkeley as well for the building materials. So a lot of the experts that have done research, for instance, on flame retardants are coming together to learn about this in a way that really fosters discussion. And I think, some of the slides that Dr. Eiten showed when I was directing the community pediatric rotation for the residency training program at Stanford, we spent a lot of time teaching residents how important it was to reach out into the community and to start to work on these problems together. There's a group called Health Begins, and it's actually a group of physicians, and they're calling themselves the Upstreamists. And it's just a really powerful example of how physicians can have a voice in the process and that we're all partners working together. So as far as hopefully we will get everyone in here involved with the U.S. Green Building Council initiative, there are really two tracks to this. Everybody has taken different pledges as to how they can be part of the solution. For the partners who have made pledges, we're doing a lot of work around collaboration, and what we've heard is from the group is that peer and cross-sector learning is one of the most powerful pieces. Learning how to speak that language, learning how to communicate the issues, and raising awareness. But the other opportunity with an initiative like the U.S. Green Building Council, which this is just for Northern California, but we're actually going to be, the U.S. Green Building Council on a national level is going to be launching an initiative to look at health. So they're looking at a lot of the work we're doing right now. But to reach out to the members in the industry and to provide education through symposiums, through workshops. And really, I think at the end of the day, we would love this, again, to become something that is part of the general outreach and doing public education. So there are a lot, it looks like I'm running out of time. There are a lot of different partner programs, and the pledges are pretty amazing. I'm more than happy to share information, and I think Dan Geiger as well would love to, he's sorry he couldn't be here today, but he would love to share this initiative with you as well. So to get more involved, this is the website, and I'm also available for questions. Thank you.